Nepal is a beautiful country situated in the foothills of the Himalayas and boasts 8 of the tallest mountains in the world, including Mount Everest. 80% of its population lives within the mountains. There are more than 24% of the population who earn less than $1 per day. Many of these poor and innocent people will die even before seeing any medicine. Delivering even the basic health care to these people has so far been impossible.
Doctors seldom, if ever, visit villages in Nepal's remote far west. People often walk 3 or 4 days to reach the nearest hospital if they need to see a doctor.
We are more than 300 patients now.
The solution to this problem came as a result of HKS graduate Charles Watson's work at High Tech Pioneer in Kathmandu for 3 months in 2009. Charles developed a computer powerful enough to stream live video, yet consuming only 30 watts of electricity. This computer became the platform for the telemedicine program launched by High Tech Pioneer's founder, Muni Sakya. Health workers and technicians were given training in Kathmandu and sent back with a mini computer to set up in a remote clinic. At the Kathmandu end, doctors were recruited to volunteer their time and expertise. Once they got the hang of long-distance examination, they established a good rapport with the health workers and have treated over 300 patients since the program began. Patients, health workers, and volunteer doctors are all enthusiastic about the success of telemedicine in Nepal.
Now let us take you to our telemedicine outreach clinic at Kelakot, in the far western part of Nepal. This place is so remote that you can only reach here after 2 to 3 days of trekking. Every Saturday, dozens of sick patients gather in this clinic. Some people have arrived from surrounding villages after a gruesome journey on a horseback ride, or even being carried by a person. In this clinic, we have an auxiliary healthcare worker who communicates history and physical examination to the doctors in the city, and subsequently provides medications to the patients. This clinic has been the only medical access for these people and the only hope of a dying person. Our team of volunteer doctors and engineers have been able to provide at least a basic health care to these poor, underprivileged people living in the village. We believe with the use of technology, we can still reach thousands of other people living in different parts of the country. We believe in ourselves, and together we can bring a change.